talking to the senator, there is a connection between the senator and this facility. Back in the early 80s when we moved into this building, and I think you were a county judge, and the senator at that time, County Judge McConnell, helped us acquire this facility. So we go way back. It's great to have you back. I want to invite the leader up in a minute, but I wanted to first just take a second and thank you, Senator, for your leadership during this crisis. And I also want to thank Congress for stepping up and taking action to help us manage through this pandemic. To put it mildly, the last few months have been a little hectic around here. When COVID first hit back in early March, Dare to Care saw an immediate spike in our distribution. Our numbers jumped about 35% in response to the initial hit of COVID. That put tremendous operating stresses on our system. First of all, we saw massive supply chain disruptions in the food supply chain, which made it difficult for us to get the food we needed to meet this increased need. Because of social distancing requirements, we had to change our entire operating model, our distribution model, and our packing model to accommodate that. We saw a pretty dramatic drop in the number of volunteers that were available to us to help us get our work done, which put incredible pressure on the team here at our Fern Valley Distribution Center, and it added to our labor costs. And then we had this, we had to buy more food. When coronavirus hit and it affected retailers and food producers, our typical lines of donated food dried up. And so we were scrambling to find the funds to buy food to fill that gap. And the last thing that hit us was just pure capacity constraints because of the higher volume of food and the higher number of clients. We were running out of space, so we had to get out and find donated space to help us get our jobs done. In the face of all that, the team here at Dare to Care made one critical decision, and that was we decided to stay open and stay on the front lines during this crisis. You know, it hasn't been easy. It's been a real challenge, but fortunately, we're blessed with an amazing group of folks who work here. These guys and gals over here, you know, we gave them a choice. We said, look, it's dangerous, you know, what do you want to do? And to a person, the warehouse and distribution team at Dare to Care made a decision not to stay at home and wait it out, but they decided to come to work. And they've been here every day on the job, putting themselves at great personal risk to get their job done. But that's what they do to make sure that people who need food can get it. So I couldn't be more proud of the team here and all that they've accomplished. We were also fortunate to have Congress act so quickly and decisively to help us manage through this situation. I was telling the senator earlier, this behind us is an example of some of the food that we've received through programs that Congress enacted in response to coronavirus. In fact, we have enough food from USDA to prepare over 2 million meals for hungry Kentuckians in our community. And that's just since March. We also received some grants through USDA to help us cover the cost of storing and distributing this food. Through the Paycheck Protection Plan, Dare to Care applied for and received a loan, which enabled us to keep our folks paid, keep them healthy, and keep them on the job. So we've had no reduction in our workforce because of that loan. And we have access through the CARES Act, another bill that Congress passed in the midst of this crisis. Dare to Care has access to another $500,000 of funding to help us pay for ongoing COVID-related expenses. So all of that support helped us weather the initial wave that we saw hit us back in March. And for that, we're grateful. More importantly, that support sets us up for success going forward as we work to deal with what we know and anticipate will be much higher levels of need going forward. So Again, Senator, thank you for your leadership and your support. And now it's my honor to bring the Republican Majority Leader to the stage, Mitch McConnell.
Thank you, Brian. The only thing Brian didn't mention that I want to take the opportunity to mention is he used to be on our team, legislative staff in Washington before coming to Kentucky. He also, believe it or not, looking at that physique today, was an offensive lineman on a college football team. How much did you weigh then?
270 pounds.
270, so he managed to shave that off. Thank you for coming out today. Let me begin by saying this has been an extraordinary year for all of us. In the Senate, we started off with an impeachment about the most partisan thing you can imagine. Then the pandemic hit, and the question was, what to do, because nobody was really familiar with this disease in the beginning. But it became clear that as a result of it, we were going to be in the process of recommending at the federal level that the economy actually be shut down in order to deal with the public health crisis. So we were confronted, obviously, with two really big challenges. Number one, how do you, in effect, prop the economy up for an indeterminate period of time? And number two, how quickly can you get to an outcome? I think we've got a little competition here. Why don't we hold up a minute and see if we can get rid of that?
We can close those doors too if you want to just move on. We can close the doors, Terry. Hey, Eric. Hey, Eric. Marty, will you close the doors? Thanks, Tommy.
Mitch doesn't care!
So the question was what to do about both the healthcare pandemic and the shutdown economy. So we put together, starting in my office, the CARES Act, and then we added another $500 billion to it a couple of weeks later to both seek to prop up the economy and to pursue testing, treatment, and vaccine in a rapid-fire basis. All of that came together in under a week and passed the Senate without dissent, which in this era is noteworthy. I think it was extraordinary that everybody came together and realized we had a huge, unprecedented challenge that needed to be tackled. So the CARES Act went at the problem in a variety of different ways. So I want to localize that to Kentucky. About $12 billion went straight into Kentucky. Brian indicated they took advantage of the popular PPPs, Small Business Loan Program. We called it loans, but if you complied with the terms, it actually became a grant. Over 47,000 small businesses and nonprofits like Dare to Care took advantage of these PPP loans in order to keep people on the payroll for an extended period of time. That 47,000 loans amounted to $5.2 billion. Looking at Louisville in particular, just looking at our community here, $133 million went straight to the city government, directly to city government. $42 million for TARC, $21 million for the airport, $12 million for U of L and its students, and nearly $2 million for first responders. So it sought to tackle the problem in a variety of different ways because we knew everybody would be impacted by it. So the question today is, where are we and where do we go from here? Let me first say the obvious: this is not over. We had hoped we'd be on the way to saying goodbye to this healthcare pandemic. Clearly, it is not over. We've seen surges in certain parts of the country, and I think it's important for all of us in public life to continue to emphasize that the single most important thing that each of us can do as individuals to protect not only ourselves, but our friends and colleagues, is to wear a mask. The single most important thing. Not complicated, totally available now, and everyone should be doing that. If they're not 6 feet away from people, social distancing, and to be on the safe side, it's a good idea to do it even if you are 6 feet away from people. We resumed the Senate in May. We've been wearing masks, we've been social distancing, we've been in session for 2 months, and we've been able to do it safely. And I think that's a good example for the rest of the country. I said after the last CARES Act passed in March that we'd take another look at it in July. So the second part of where do we go from here, everybody should be wearing a mask. That's what each of us can do to be helpful. And we will be taking a look at, in the Senate in a couple of weeks, another package based upon the conditions that we confront today. We've been pleased at the number of jobs that have come back. There is an indication the economy is likely to come back, but there's still challenges. For us to have a normal situation across the country, it seems to me the next package, if there is one, and I believe there will be one, must contain the following. Number one, liability protection. And this is not just for businesses, this is for hospitals, doctors, nurses, nonprofits, universities, colleges, K through 12, so that people who acted in good faith during this crisis are not confronted with a second epidemic of lawsuits in the wake of the pandemic that we're already struggling with. Unless you were grossly negligent or intentionally engaging in harmful conduct, you should be protected from liability during this process. Why is that necessary? As of a couple of weeks ago, there were already 1,100 lawsuits filed, and there's an army of trial lawyers out there ready to take advantage of this situation. We cannot get back to normal if we have an epidemic of lawsuits. Number two, the kids need to be back in school. We can't have a normal country if kids are not in school. And kids and jobs are directly related. So if you're looking for what I think the theme of a next package that I'm likely to roll out here in a few weeks would focus on, liability reform, kids in school, jobs, and health care. That's where the focus, it seems to me, ought to be. Obviously, for anything to pass the Senate and certainly the House, it will ultimately have to be done on a bipartisan basis, but every bill has to start somewhere. And just like the CARES Act started in my office as the majority leader of the Senate, this bill will start in my office as well, in consultation with the administration and also with Senate Democrats. We'll be moving forward in all likelihood sometime during the month of July. So mainly, Brian, I wanted to come by and thank all these guys in the back for coming to work and helping us through this. This is an extraordinary example of a great organization that's existed a long time, helping those who need them, who need help, And I'm glad the CARES Act was allowed them to help do their job better. So with that, I'll take a couple of questions, if there are any. Yeah.
Well, I'll ask the one that's been in the parking lot. You heard a gentleman say that you don't care. What's your take on the racial injustice concerns in Louisville right now and the continued demonstrations about Breonna Taylor?
Well, it's very, very concerning. I think the murder of George Floyd, the incident here in Louisville, Breonna Taylor, have certainly brought to the fore for everyone that there's a good deal of racial injustice still in America. We want to continue to deal with this problem. It's America's original sin, and we've worked for a couple of hundred years to improve, and obviously the job is not done yet.
What are you doing?
We had on the floor of the Senate Senator Tim Scott, a Republican African-American senator from South Carolina, a police reform bill that we thought made sense for the country. Most of these reforms are at the state and local level, but there is a role for the federal government to play. Unfortunately, our Democratic friends prevented us from taking the bill up, and so as a result of that, we've not been able to act yet.
You begun airing an ad that talks about some of the statues being torn down. Are there problems in your mind with some of the things that are happening during the protests, and if so, what are those issues?
I think there's certainly problems with rioters and looters and people who want to tear down statues of people like Washington and Jefferson and Grant, who freed the slaves. That, it seems to me, is intolerable. I'm a big fan of peaceful protesting. That's a constitutionally protected right in our country. I'm not a fan of rioting, looting, mayhem, and tearing down the statues of the people that crafted the beginnings of this country.
In Louisville, they banned no-knock warrants. Is that something you would like to see done federally?
Will you take your mask off?
In Louisville, as a result of the killing of Breonna Taylor, they banned no-knock warrants. Is that something you'd like to see banned federally?
Well, that is something we could have debated at the federal level had our Democratic colleagues in the Senate let us take the bill up. It's certainly a discussion worth having. I noticed that the city council here did ban no-knock warrants, and many communities may well do that.
You mentioned relief to schools in the next package. What, in your mind, like what would the size of that be, and what particularly do you think the schools need aid with?
Yeah, I've talked to virtually all the college and university presidents in Kentucky, and I've talked to leaders of the organizations of the public school system, K through 12, during this process. Everybody wants to be back in school. Obviously, they're going to have to adapt. Many of them may have to go to every other day in order to deal with the social distancing, the spacing, and the other things but everybody knows we can't get back to normal without going back to school. So that will be a part of any package that I craft and we take up in the Senate for a debate to do whatever we can to help America get back to normal. And right at the top of the list is kids in school. Parents are literally petrified of the possibility of kids not being back in school. And that directly affects jobs, obviously, as well. So that'll be a focus. Thank you all for coming out. Good to see you.